Good morning, Mary Jo.
Hi.
How are ya?
Better than nothing.
Better than nothing. How was your night?
It wasn't too bad.
You got some good sleep?
Yeah.
A hospitalist is essentially the primary care physician in the hospital. So we manage everything and anything the patient is dealing with. We call consultants when necessary. We work with ancillary services like PT, OT, dietary, and basically manage the patient from the minute they get admitted to the hospital to the minute that they get discharged, where then we hand their care back over to their primary care physician. Any questions you have for me?
Oh no, I'm okay.
Okay, is there anything I can get you while I'm here? And in a given day, I can see a 100-year-old patient with heart failure. We can see 20-year-olds with kidney stones. We see post-surgical patients. We see patients who are there after a heart attack. We see patients who are in the hospital after a stroke. A little bit of everything every day. Okay. How's your swelling today? Your hands and your feet?
Better.
Yeah, your hands look a little better actually. So when we round, we're not just seeing patients, we're interacting with the patient's bedside nurse, with the case managers, with the social workers. Any given patient, I'll go up and see the patient. A lot of times the nurse happens to be in the room or sees us walking in and comes in with us so they can hear the plan for the day and hear kind of the questions the patients have so that they can later kind of come back in and answer questions or relay stuff back to us.
They see a wider range of conditions that maybe primary care physicians don't see in the clinics, so they get to treat the higher end of those conditions and they're more specialized in those areas.
We also stop and talk to social workers and case managers to start working on arrangements for discharge. Yeah, well, I think he's hoping to get you home today.
Yeah.
How's that sound to you?
Yeah, that sounds wonderful.
Working on things like, what do you need to get home? Do you need home health? Do you need to spend some time at a skilled care facility? We can answer a lot of questions right then and there when we're on the floor rounding, working with those specialties. And they want to do it at home, but I think first we got to get you feeling a little bit better in general.
I think you gotta have,
From a patient care standpoint, there are multiple benefits of having a hospitalist on their care team. They are available for 24-hour care when they have different emergencies or things arise. The staff can call them and they can come in and get eyes on the patients and help treat the patient for any needs that they have.
Few changes, it's perfect where it is now. That's exactly where we want it. But she just felt like doing it today, maybe was rushing it when we didn't
Not
need to.
as good as it was.
I think there's a couple benefits to having a hospitalist program. I think having physicians that are in the hospital 24/7 that are the primary physicians means there's always someone there if a problem arises. It expedites care. There's always someone there kind of coordinating between specialists who are not always in the hospital. They're sometimes in clinic, they're sometimes in the OR, they're sometimes doing procedures. So there is always a physician kind of managing those things. We're a good go-between between the patient and nurses or nurses and specialists. And so I think it expedites care. There's really good data to show that hospitals provide really good care in the hospital, and patients leave the hospital sooner when there's a hospitalist involved.